Alberta's Health Ministry says there are over 200 cases of measles in the province. This as the province's health authority reports a potential measles exposure at the South Edmonton movie theater. Alberta Health Services telling City News if you were at the Cineplex in South Edmonton Common after 8:30 the night of April 26th, you may have been exposed to the highly contagious virus. As of Monday afternoon, there have been 265 cases in total in the province, over 40 of them still active, with 3 patients currently hospitalized in intensive care. Minister LaGrange urging Albertan parents to vaccinate their children, saying unvaccinated minors make up the majority of cases.
What is concerning is that 179 of the cases in Alberta are impacting children under the age of 18. As a mother and a grandmother, I feel for the parents and guardians of those children as they watch their children deal with this horrible virus.
The majority of measles cases in Alberta are in the south and central zones of the province. Parents of school-aged children and the groups who represent them say that's causing worry in central Alberta.
Particularly with kids who are involved in sports and they're traveling, whether it's hockey, soccer, baseball, whatever the case may be, going out to competitions, potentially contracting something while they're away, bringing it back into the school community.
Mother of 3, Megan Parisian, is with a group representing Albertan parents in Red Deer, adding while herself and others are worried about rising measles cases, her children's public school administrators have been monitoring and communicating with parents.
So I'm confident that if it came to a point where I needed to pull my kids out of school from a safety perspective, that I would be able to do that proactively as opposed to reactively.
The province says they will be working with schools and daycares to increase vaccine uptake, but the opposition NDP says this should have been implemented months ago.
Well, at least 6 months ago when we started seeing that measles was creeping up in other parts of the world, they should have been working aggressively on public health vaccine campaigns, specifically around measles, mumps, and rubella. There's still a lot of people out there who don't have 2 doses. We need 95% herd immunity to keep each other safe.
Starting Monday, anyone calling HealthLink 811 about measles will be directed to a new hotline. Reporting from Edmonton, Darcy Ropchan, City